Eczema. Very common in the Indian population today. I saw 3 children, all East Indian background, 2 new patients with eczema. Very common. It's also called atopic dermatitis, chronic, long-lasting condition. Immune cells in the skin overreact. Skin becomes itchy, dry, inflamed, and scaly. There's no cure for eczema. We can get people under good control if they're managed correctly. That's the thing. Management is the. So how does eczema differ from other skin conditions? There's something called contact eczema. It's a rash similar to regular eczema, but caused by contact with an irritant. No family history of eczema, asthma, or allergies in these patients. Normally, they just are allergic to something they come in contact with, like hands, excessive cleansing, which is happening a lot now with COVID. Psoriasis. Localized patches often on the elbows, scalp, buttocks, and the backs of the knees. The front of the knees. That's incorrect. Front of the knees. And it also gives you pitted nails and patches on the scalp. That's very, very common. Eczema in the general population affects about 15 million people, 10% of all infants, probably 50%, that's probably a low number, of all Indian background children in this country have had it. Incidence is increasing, doubling over each of the past few decades. That may be because we're too clean, spend too much time in the shower, do too much bathing. I'll teach you some proper bathing techniques. 80% of cases appear before age 5. 40 to 60% of patients still have some symptoms as adults. About 80% of patients also have asthma and or allergies. Strong genetic link among families, a family history of atopy, which is allergic diseases like asthma, allergies, and atopic dermatitis, in 70% of eczema patients. Itchiness, inflammation, redness, scaling, weeping or oozing, skin thickening and hardening, crusting, and secondary skin infections. So on the face, on the legs, it starts on the face, the arms, the elbows, and the knees in younger children and infants. And then it goes into the arms and behind the knees, the wrists, the ankles, creases of the elbows. Certain allergens, such certain foods and irritants, can make it worse. Climate, emotions. When people get stressed, they tend to flare more. Peanut butter, maybe. Food triggers are only occur in about 5% of people. Reduce household allergens, keep carpets and clothing clean and free of pet dander, dust, wear 100% cotton clothing washed with mild detergent, avoid bleach and fabric softeners. Practice healthy bathing and moisturizing habits. Lukewarm, non-soapy water, lightly pat dry, use a thick moisturizer. Use soap essentially only on the hairy area. That's true as for adults with eczema too. Scalp, face, underarms, and groin. That's it. Try to limit your stress and anxiety, and important for preventing and reducing flare-ups, but not in of itself enough to clear eczema. So you'll get somewhat better, but you'll never clear with just these things. But proper bathing, another good thing that you can do on weekends with eczema children and eczema adults, is a 30-minute soaking bath with 2-3 tablespoons of bleach. The other thing that I like to use a lot is coconut oil massage for the child. Massage them like grandma does, and put them in the sunlight, because sunlight and coconut oil are natural anti-inflammatories. You need to use a thick, creamy, oil-based moisturizer, Vaseline. You don't like Vaseline, shea butter, coconut oil. I like ghee. Ghee works great. Crisco works wonderfully, but it smells, so people don't like it. Most effective when used immediately after bathing. Apply throughout the day whenever skin feels dry. You want to use a cream, not a lotion. And Vaseline ointment is the best. Not effective for moderate or severe eczema if used alone. Helpful when used with other treatments. You always can put the moisturizer over everything. Treatments, you can do tar treatments. They're anti-inflammatory. They are a little bit odorous and stain clothes. Used mainly at bedtime. Light treatments, very effective. Used successfully for chronic severe disease, require multiple office visits. Potential risk for skin cancer with long-term use. That's actually not correct anymore. It's an old slide. Now we use a type of light treatment that doesn't have that risk. It's very safe. It's called narrow band. So no one uses wide band anymore. It's all narrow band, one wavelength. That has never been shown to cause a problem. Antihistamines are prescribed for itching, may not be effective. Sedative effects may provide relief when used at bedtime. So these are Allegra or hydroxyzine, things that give some relief. Antibiotics. Cracked skin due to itching often becomes infected. Antibiotics are effective in treating the infection. Antibiotics do not treat eczema. They're only used when you need them, not continuously. Topical steroids, best available eczema treatment for 40 years, range from super high to low potency. Effective, but may have many side effects if overused incorrectly. Okay? Everyone has this bugaboo with using steroids. Yes, if you take it orally or use high potency for many weeks or months. And recently a study was done that even if people overuse it, they still don't have a significant negative effect. However, when people stop them, they tend to flare back up again because they stop them all of a sudden. So people say, well, I have a steroid dependent eczema. Not quite. Your eczema was controlled and then you went off medicine too quickly. We're also looking for non-steroid creams now, kind of for long-term maintenance. But that's important that you know that low potency steroids for long-term use are safe, and I don't have a problem. So limitations. High potency should not be used on the face, groin, or armpits on children younger than 12, unless well controlled, for longer than 2 consecutive weeks. You can use it up to 4, but 2 is usually a good number to stop. Low potency is effective for mild cases, less risk of side effects like thinning of the skin, but may not be as effective in controlling. Oral steroids are usually used after topicals fail, used in adults, affects the entire body, not just the skin with eczema. Side effects, long-term use, I'm talking about 2-3 months of use, not 2 weeks. It's high blood pressure, weight gain, loss of bone density. Topical immune modulators work a new type of eczema treatment, work in a different way than steroids. First new treatment in more than 40 to 50 years. Tacrolimus, pimecrolimus, and Eucrisa are the 3. People who Google tacrolimus and pimecrolimus will see that it's got a black box warning. Well, the black box warning was generated by people who didn't know what they were doing. If you look at the data closely, which nobody ever does, they look at the black box and they all freak out. If you look at the data, it was flawed. It took rats and exposed them to sunlight for like 20 hours a day for a year. Well, the average lifespan of a rat is only a year or 2 anyway. So that's half the life of a rat. And if you do that, they do develop skin cancers if you use tacrolimus, pimecrolimus on them. However, the control rats who also had Vaseline put on them also developed skin cancer. So it's a flawed study. The FDA mandated it to check for skin cancer risk. And if these rats that were used have a disposition to getting skin cancer anyway. So even if you don't expose them to much sun, they get it anyway. So it was a mistake. Our national organization asked for it to be taken off, and they didn't do it. And a recent study was done tracking the use of tacrolimus and pimecrolimus since the year 2000. That's almost like 18 years, and there's been no increased risk of anything. So I want to get that idea out of people's minds and throw in the garbage. Anyway, Eucrisa is the newest one. It does not have any black box warning, but I don't think the others need it either. Eczema disease process. During an eczema flare, it is believed that the immune system goes into overdrive when a person comes in contact with certain triggers. The immune cells are overproduced, which causes a flare-up. Topical immune modulators and corticosteroids reduce the effect of these cells and the inflammatory chemicals that they produce. That's the principle. Very exciting time in new eczema therapy. Dupixent is out. It's a systemic agent for bad eczema, works beautifully. I did the study to get it approved in the United States. I'm doing a study with 5 other injectables and new non-steroid creams. So we're looking at non-steroid options. There's 2 companies with amazingly good creams that I think will make a big difference. 3 actually. So this is a kid who took tacrolimus. You can see eczema around the eyes and around the mouth. And after about 2 to 4 weeks, good reduction in eczema.